Again, if you've got stiff joints that don't match your age, lingering pain that wakes you up at night, swelling in your fingers you can't explain, or a kind of low-grade inflammation no one seems able to pinpoint, again, there is an ancient spice worth understanding before you reach for another bottle of painkillers. The catch, and this is the part nobody tells you in the supplement aisle, is that most people take it in a form their body can barely absorb. So they feel absolutely nothing. Again, they walk away assuming it just doesn't work for them, and they never give it a real fair shot. Today I'm Dr. David, and I'm walking you through what actually happens over 21 days when you take turmeric the right way, again, and why this one simple change is what I lean on most often for patients dealing with stubborn daily joint pain that has already stolen too many mornings from them. Let me start with a real case so you can see this isn't theoretical. I had a patient I'll call Linda. Again, Linda was 58 years old. She had been dealing with rheumatoid arthritis for nearly a decade before she walked into my office. Most mornings, her hands were so stiff that she could not open a jar of jam. She could not button her shirt comfortably. Again, she could not grip a steering wheel without pain shooting up through her wrists. She had been on and off NSAIDs, prednisone, and even methotrexate over the years from her rheumatologist, and while those medications did knock her inflammation down, the side effects were brutal. Again, she had constant stomach upset, her face was puffy from the steroids, she was gaining weight, and her energy was completely shot. She felt like she was trading one set of problems for another every single month, again, and she had started to wonder whether feeling good again was even something her body could do. I gave her a detailed diet, sleep, and movement protocol. I walked her through an anti-inflammatory eating plan. I talked about sleep timing, light exposure in the morning, again, and how to protect her circadian rhythm so her immune system would calm down at night instead of staying revved up. I talked about low-impact movement to protect her joints while still building strength, including pool walking, gentle strength work, again, and mobility drills she could do from her kitchen. But she sat there, looked at me across the desk, and just asked if there was one thing she could take, just one thing, that would work like the NSAIDs she had been relying on for years, again, but without the side effects that had slowly taken over her life. What could she actually do starting this week while we set up the bigger plan underneath it? Well, I put her on a whole spectrum turmeric complex, again, and the results were honestly faster than I expected and more complete than she had dared to hope for. Within 2 weeks, she started noticing real tangible changes. Her morning stiffness went from about 40 minutes down to roughly 15. She was opening jars again, she was sleeping deeper, again, and by 21 days her pain was meaningfully under control. She had significantly better mobility in her hands and her knees, her energy had started to come back, and she had cut her ibuprofen use in half without even trying. Linda became a believer quickly, again, and because she felt something real, she became much more open to the diet changes and movement strategies I had laid out for her, and within 4 months she had dropped 22 pounds. Her inflammatory lab markers had improved dramatically, again. Her rheumatologist was talking about tapering one of her medications and she was genuinely out of pain. So I'm going to show you exactly why the one thing I had Linda do was use a high-quality turmeric complex, again, and why this works completely differently than the painkillers sitting in your cabinet right now that only mask the signal for a few hours at a time before the pain comes right back. You see, turmeric is a root. It looks a lot like ginger, again, and it has been used in traditional cooking and traditional medicine systems for thousands of years. Curcumin, you have probably heard of that word, that's the primary bioactive compound inside turmeric. Again, it doesn't work like an over-the-counter painkiller that simply blocks a pain signal at the nerve. Instead, curcumin interacts with the body's inflammatory signaling pathways, most notably the nf-kappabeta pathway, again, which is often described as the master switch for inflammation in the body. When that switch is stuck in the on position for months and years at a time, you get chronic inflammation, you get joint pain that won't quit, again, you get swelling that keeps coming back no matter how much you ice it or how often you stretch. Curcumin works upstream of all of that. It works on the signaling itself, not just the symptom on the surface. Again, human studies link curcumin to measurable reductions in key inflammatory markers like hsCRP, that's high-sensitivity C-reactive protein, TNF-alpha, and interleukin-6. These are the exact markers most doctors run when they suspect chronic inflammation is driving someone's symptoms, again. And when those numbers trend down on paper, you can feel it in your body and how you move and how you recover. Randomized controlled trials in arthritic populations have found that curcumin can reduce joint pain comparably to ibuprofen as well as aspirin, again, with a far more favorable side effect profile. And unlike chronic NSAID use, curcumin is not associated with gastrointestinal lining damage, it's not associated with kidney stress, again, and it's not associated with increased cardiovascular risk the way long-term NSAID use has been shown to be. That is great news. Again, and it is important context for anyone managing long-term joint pain who has been told They simply have to live with the side effects of their medications, or quietly accept the trade-offs that come with them. Now, let's talk about some realistic framing, again, because I never want to oversell a single supplement, and I never want to set you up to be disappointed on day 4. Turmeric is really a supportive tool that works with the body's own anti-inflammatory and antioxidant systems. It is not a fast-acting drug. Again, it is not going to feel like popping 2 Advil and having your knee stop hurting in 20 minutes. That is an important nuance to remember because it is exactly why most people quit turmeric too early. They expect a drug-like response from an herb, they don't get one, again, and they walk away thinking the herb failed them. And because of that nuance, the way you take it, the form you take it in, and how consistent you are will completely determine whether you feel anything at all or whether you feel nothing. Again, that part is on you as much as it is on the supplement itself. Now, this is the absorption problem most people never hear about, and this is the single biggest reason people tell me, "Doc, turmeric just didn't work for me. I tried it for a month and felt nothing." Again, the reason is that it never actually reached their cells where it needed to do its job. You see, curcumin is poorly absorbed on its own. Plain turmeric powder, plain turmeric capsules without absorption support, they have a fundamental problem built into them from the start. Again, a very small fraction of plain turmeric makes it from the digestive system into the bloodstream, and an even smaller fraction reaches inside of the cells where the inflammatory machinery actually lives and where the nf-kappabeta switch sits. There are 3 levels to understand here, again, and each one is harder to reach than the last. Level 1 is the gut. The curcumin has to survive stomach acid and make it through your digestive tract without being broken down or degraded along the way. Level 2 is the bloodstream. Once it crosses into circulation, again, your liver starts metabolizing it and most of what made it that far gets cleared out before it ever gets a real chance to act on those inflammatory pathways I just talked about. Level 3 is the cell. The cellular membrane is another barrier entirely, again, and only what makes it past that membrane can actually influence gene expression and signaling tied to inflammation in a meaningful way. Most cheap turmeric products fail at level 1. Most generic products fail at level 2. Again, almost nothing reaches level 3 without real engineering behind it. Now, here's the good news. There are well-studied ways to dramatically improve absorption at each of those levels. Black pepper has a compound called piperine, again, and that meaningfully increases absorption into the bloodstream by slowing the liver's clearance of curcumin and giving it more time in circulation to do its work. Some of the commonly cited figures are quite dramatic. They will say, around a 2, again, % boost in absorption of the curcuminoids from turmeric when black pepper is brought in along with it. That is not a small number. That is the difference between turmeric working and turmeric doing nothing at all. Healthy fat matters as well, again. We know curcumin and all of the compounds in turmeric are fat-soluble, so taking them with a fat source supports absorption at every level we just talked about. That is why taking a turmeric capsule on an empty stomach with just water is one of the worst things you can do. Again, you are basically guaranteeing poor uptake and setting yourself up to be disappointed. Whole food turmeric contains hundreds of additional compounds beyond curcumin. The research suggests the full spectrum may offer benefits that isolated curcumin alone does not. Turmerones, turbiners, again, and a whole family of polyphenols and volatile oils work alongside curcumin in a kind of symphony that we are still working to fully understand. So really the takeaway is this. Curcumin is the most well-studied compound in turmeric, again, but there are a whole bunch of other really powerful compounds that just don't have as many human studies around them yet, and we are likely underestimating their contribution to the overall effect. And the form and the formulation matter more than the raw dose. Again, a high number on the label means little if it can't actually be absorbed. Now let's go into the 21-day timeline that I talked about in the beginning, because this is where most people either fail or succeed with the protocol. I typically begin this protocol with 500 to 1, again, some milligrams of whole spectrum turmeric taken 1 to 2 times daily, so really about 1,000 milligrams altogether to make sure it is well tolerated, and this gives time for the body to adapt to it. So 1,000 milligrams a day total. Again, you can take it in either 1 dose or 2 doses. Take it with meals. That is non-negotiable if you want the absorption story I just walked you through to actually hold. Phase 1 is what I call the quiet start. This is day 1 to 4. Again, most people feel little to nothing in the first several days, and that is normal and expected. Again, turmeric is not a stimulant. It does not give you energy. It's not going to wake you up or make you feel alert. It works gradually beneath the surface the way real healing does. Again, behind the scenes, it is beginning to lower oxidative stress, and it is calming an overactive immune response that has been firing for months or years without a break. Some people may notice subtle early shifts, mild digestive comfort instead of the usual post-meal bloat. Again, slightly less bloating through the afternoon, a touch less morning stiffness when their feet first hit the floor. The key mindset here is this. Absence of a dramatic feeling does not mean it is not working. It is working under the kind of clinically appreciable level, again, not the kind you feel like a caffeine buzz or an Advil kick. That distinction is everything, and it is what separates the people who get real results from the people who throw the bottle in the trash on day 4 and tell their friends turmeric doesn't work. Then we hit phase 2, again. That is the gut and joint turn. That is days 5 to 7. Early noticeable changes tend to emerge in this window for many people, sometimes for the first time since their symptoms started in the first place. The digestive system starts to improve, again. We know curcumin supports the gut barrier integrity and a healthier balance of gut bacteria, which reduces a key source of low-grade inflammation that often drives joint symptoms downstream. A lot of the chronic inflammation people walk around with is actually gut-driven, again, and this is where turmeric has some of its most established and traditional benefit in the literature and in traditional medicine systems. Joint-related changes start showing up too. Some people report they have less stiffness rising from a chair in the morning, again, reduced creakiness in the knees when they squat down, easier movement early in the day before things typically loosen up. That is particularly relevant for those dealing with gut-driven inflammation or autoimmune-related flare patterns. Again, this phase reflects turmeric's most established and traditional benefit, its effect within the gut itself. And for Linda, this is exactly when she started noticing her morning stiffness dropping from those 40 minutes down toward 15. It was not dramatic, it was quiet, but it was real, again, and it gave her the confidence to keep going and not quit when she did not feel anything yet. Now, phase 3 is the inflammation shift. This is days 8 to 14, so the second week. This is where I bump the dosage to 1,000 milligrams 2 times daily. So overall 2,000 milligrams, again, but in 2 divided doses of 1,000 milligrams twice with meals. This is the window where measurable biochemical changes begin to appear in research on blood markers, though typically these become most robust at 4 or more weeks of consistent use. Again, so a 21-day protocol may capture the early part of this, not the entire curve, but enough to start seeing a real noticeable signal in how the body feels. The inflammatory markers I mentioned earlier, C-reactive protein, TNF-alpha, interleukin-6, again, they trend downward in studies using well-absorbed forms. Commonly reported subjective changes include less joint swelling, improved mobility, less discomfort during walks or workouts that used to leave people sore for days afterward. Again, so the distinction that's worth emphasizing is that this is pain reduction through lowered inflammation. We are not just trying to mask pain, again. And so that is the key differential here between using something like turmeric versus taking some sort of pain medication that simply blocks the signal for a few hours and then wears off, leaving you right where you started and reaching for the bottle again the next day. Now, again, phase 4 is what I call the inflammation breakthrough. This is the last week, days 15 to 21. At day 15, I give a powerful dosage. 2 caps 3 times daily or 3 caps 2 times daily, ultimately 3,000 milligrams altogether, typically in 2 or 3 doses. Either 2 doses of 1, again, 500 milligrams or 3 doses of 1,000 milligrams taken at mealtime so the fat in those meals supports absorption along the way. We do this high powerful dosage for 7 days. This dosage dramatically impacts the nf-kappabeta pathway, that master inflammation switch, again, and it meaningfully shuts it off in a sustained way, rather than just briefly tamping it down. This is where you really feel the impact of the protocol, or sleep quality, faster recovery's activity, less post-exercise soreness, less reliance on pain medications day to day. Again, at the cellular level, curcumin is associated with influencing gene expression tied to inflammation and antioxidant defense. It activates the NRF2 pathway, which switches on the body's own antioxidant and detox systems, and it supports mitochondrial function, again, which is the energy-producing machinery inside every cell. It also supports glutathione, one of the body's most important internal antioxidants, the master antioxidant that every other antioxidant in the body depends on. Again, the shift being described here is from constantly reacting to inflammation toward a less reactive baseline over time, a more calm and stable immune system that is not constantly cycling up and down all day. And that is exactly what Linda described to me at her 3-week check-in. Again, she said she hadn't taken ibuprofen in over a week. She was sleeping better. Her hands were not locking up first thing in the morning anymore, and she had biked with her grandson for the first time in 2 years. That last part was not in her goals when she walked in. Again, that came from a body that was less inflamed and finally able to do things again. Now, it is important to know that 21 days is a strong start, but curcumin's deeper benefits accumulate with continued consistent use beyond 3 weeks. After the 21 days, Again, we have hit an inflammatory lowering threshold, and then I drop that dosage. Remember, we were taking 3,000 milligrams that last week, so we drop it back to 1,000 milligrams 1 to 2 times daily. Either 1,000 milligrams all at once or 500 milligrams twice daily, always with meals. Again, and this is a maintenance dose that is sustainable for the long run without overdoing it hourly, and without losing the gains we worked to build up over those first 3 weeks. Now let's talk about how to take it for real results. Again, because even a great supplement used wrong will underperform and waste your money. Remember, I have been constantly saying take it with a meal. That is important because it is fat soluble, so you always want to make sure you are taking it with a meal that has healthy fats. Avocado, again, olive oil, eggs, nuts, salmon, coconut oil. Any of those will do. The fat is part of the absorption story, not optional. Choose a form that includes black pepper and ideally whole food turmeric with a fat source already built into the formulation like coconut oil. Again, separate it from intense exercise by at least an hour. We know that high-dose antioxidants taken right around training may blunt some of the beneficial adaptation response to exercise, including the mitochondrial adaptations we are trying to build. So timing matters here. Again, consistency is everything. Daily use over the full window is what drives results, not occasional doses when you remember to take them. So stay consistent with it. If you are inconsistent, you are going to get inconsistent results. Again, that is just how the body works with any therapeutic intervention. Now, what to look for in a quality turmeric, and my recommendation, this is important because the turmeric market is full of junk and mislabeled products. We want to avoid products with no black pepper, again, no absorption support, no disclosed sourcing or third-party testing, or suspiciously cheap pricing. We know that turmeric can be adulterated with fillers or contaminated with heavy metals, and the global turmeric supply chain is notorious for this. Again, lead contamination in cheap turmeric is one of the more common issues I see when I third-party test patient samples in my clinic. Cheap turmeric on Amazon with thousands of glowing reviews and no testing? Buyer beware every single time. Again, so what you want to look for is full-spectrum organic turmeric. It should have black pepper, a fat source like coconut oil or something like that for absorption, and verified third-party testing. That is important to make sure it has got the dosage correct. Again, that what it says on the label is actually in the capsule, and that it does not have contaminants you do not want accumulating in your body over months of use. What I like is Paleo Valley Turmeric Complex. It checks all of those boxes. It is organic whole food turmeric, again, which is full spectrum, not isolated curcumin. It has black pepper for absorption. It has coconut oil powder, the healthy fat that supports uptake, and it has an array of synergistic whole food botanicals, ginger, rosemary, and clove, again, which are each studied for their own antioxidant and anti-inflammatory properties. And when they are combined, the synergistic effect magnifies the benefits of each one individually, beyond just stacking them on top of each other. It is also third-party tested with clean sourcing, again, and that is exactly what I want for my patients. This is the product I had Linda use, and it worked wonders for her, and I have seen that with other people as well, which is why I have so much confidence in this protocol for the right kind of patient. With Linda, again, the first week we did 2 caps 1 time a day, second week 2 caps, 2 times daily of course, with meals, and then the third week we did 3 capsules 2 times daily with meals. Then we dropped back to 1 capsule 2 times daily with meals. Simple as that, again. And we got those awesome results that I talked about earlier, including the lab work, the weight loss, and her rheumatologist finally starting to taper one of her heavier medications for the first time in years. Let me get into your questions. Number 1, is daily long-term use safe? Again, well, for most people, yes, but turmeric can have a blood thinning effect, so anyone on blood thinners or anybody with gallbladder issues or preparing for surgery should consult their healthcare provider first. Once you get your pain and inflammation under control, you can cycle it. Again, that is really what I recommend. Do 3 weeks on, 1 week off. So if you are taking it over the course of a month, 3 weeks on, 1 week off, that is a really good cycle. And that tends to be a good way of approaching herbs in general. That way, again, you get the best benefits of herbs and you do not, in a sense, habituate to the herbal properties, right? So 3 weeks on, 1 week off. And I would do that after an intensive 2-month period. So take it intensively for 2 months, again, and then get on a maintenance protocol where it is 3 weeks on, 1 week off. And that tends to work really, really well when it comes to turmeric. And that is what I had Linda do after her first 60 days on the higher protocol. Now, the second question is, can I just cook with it? Again, and the answer is yes. Culinary turmeric offers real gut-level benefits, and of course it is inexpensive to just use the powder from the spice aisle. And pairing it with black pepper and a good source of fat, as in many traditional dishes, particularly Indian dishes, again, is genuinely smart. So making curries and having turmeric in your cooking is a great way to go about it, and that is already optimized for good absorption by tradition. However, with that said, for the systemic cellular level benefits, again, a well-absorbed supplemental form is more reliable. The dosing is exact, the absorption is engineered, and you know what you are getting every single time you take it. So I recommend getting it in your diet as well as using it in the supplement form. There is nothing wrong with that, again, and that will get you great benefits from both angles, the daily kitchen angle and the therapeutic supplemental angle. Now the next question is, should I take turmeric or should I take curcumin, again, which is again that isolated antioxidant that is from turmeric that is really well studied. Which one of those is better? Well, we know there are lots of great studies on curcumin, and lots of people are taking curcumin supplements out there, and they are getting great results. However, again, with that said, I recommend whole food turmeric that provides curcumin plus hundreds of supporting compounds, so full spectrum formulations may offer more than isolated curcumin alone. You are not just getting the one famous compound, again, you are getting the entire plant matrix that nature put together for a reason, and your body knows how to use all of those compounds together in ways we are still discovering. 21 days is enough to feel the start of what turmeric can really do. Less stiffness, easier movement, again, better recovery, better sleep. But only if it is in a form your body can actually absorb, taken consistently with fat away from your workouts. And this is not about masking pain, it is about lowering the inflammation creating it in the first place. Again, really getting to the root cause of what has been driving your symptoms. And folks, if you want more on lowering inflammation, I have got a great autoimmunity and inflammation e-guide. Check that out in the description box below. It is free to get, again, so click that link in the description box. And if this gave you a clearer picture of how turmeric really works, share it with someone dealing with joint pain who has been stuck in the same loop. Hit subscribe and let me know in the comments, are you going to try the 21-day protocol, again? And what kind of pain has been holding you back the most? And if you want that Paleo Valley Turmeric Complex, that is also in the description box below, along with a special code to get you a great discount on that, so check that out. Of course, be blessed, again, and we will see you in a future video.